Good afternoon, everyone. Dr. Owens here. Welcome to our office. I wanted to give you a brief tour of our office because some of you have never seen a chiropractic office before. And we'll give you a little glimpse inside of what it's like to come to see a chiropractor when you're having problems with your health. So this is our reception area that we have here. And when you first come in, you'll be greeted. We'll get you sorted out with your paperwork. This is Morgan at the front. She may be here to help you, or it may be Sarah. Sarah Starkey, she also helps us out at the front. So when the paperwork's completed, we'll go on back and we find out a little bit about your health condition. And in the back we have 3 treatment rooms. When we look inside the treatment room, here's treatment room 1 here, and we'll come on to treatment room 2 here. And we have 3 because sometimes people come as families, or they need special attention, and so when there's a little bit of an overflow, we can handle the volume. So come on in here. This is my main treatment room. We have many different means of helping patients here at the clinic. We have, of course, I offer manual adjusting, where we adjust you physically. We're actually moving the bones and getting them moving in the right place. That's not for everybody. If it's someone who's getting on in years, or perhaps maybe a baby, we use a little tool called the ArthroStem. It's an adjusting tool, and it just does very light, gentle tapping, and we're able to take those bones and get them moving, get them functional again, without the use of any kind of extra force. So it's a nice tool for people that do not want to be manually adjusted. And then we also, of course, have the ever popular master massager that would be done at the end of each visit for a little bit, just to help the blood flow and circulation. And it also feels great. One other thing that we also started offering about a year ago was kinesio tape. Kinesio tape was made popular in the Olympics this year, the Summer Olympics, and you may have seen some of the volleyball players wearing it on their shoulders. Well, I found it is a great way to stabilize brand new injuries. It's almost like my way of sending an adjustment home with you. If we need to do this, we can, and insurance covers it, of course. So come on back with me, and I'll show you the rest of the clinic. Now we're heading to the back part of the clinic where Jason is, and he's our massage therapist, and he's also our personal trainer. So I'll show you the gym, and it's where we can also actually have you doing some supervised exercise if you need it. So come on with me. We'll head on back. Well, this is our gym right here, and we've got it pointed with the things that Jason and I felt. Both of us exercise and have been in gyms and been around weight training equipment, and we know what's really the best, and we know what's kind of a fluff and what really doesn't give you much results. We wanted to put the stuff that will give you the best results. What we have, what Jason uses, a lot of these are what we just call them stretchy bands. They provide a phenomenal amount of resistance. The further you go back, of course, there's more resistance. And man, they may look easy, but believe me, they will get you going. Over here, we have our BodyCraft station, which we can do all of the major exercises that you would need: pull downs, the chest presses, leg extension, leg press here, also some of the cable work as well. It's a fantastic machine. It's been a real workhorse in here, and Jason loves it. The patients love it as well. Of course, here we have our basic weight setup. For those people who are going for a little more bulk or want to get more strength, we have the power rack here with the Olympic weights, some more bands here, and then the elliptical machine. So we are a chiropractic clinic, but we have a focus on function here, and our our goal is to get you back into life, doing the things you want to do with chiropractic and with strength training, with flexibility, with yoga, whatever it takes to get things, get your health problem handled and get you back into action. I'm Dr. Owens. Have a great day. Show you an instrument that I use in my practice every day, and it's a super little adjusting instrument called the ArthroStem, and it's an electronic version. Some of you may have heard of like the Activator. It's a handheld clicking instrument that puts a force into the bones. This is an electric one, and it does a tapping motion into the bones and allows me to adjust safely at a lower force. I can adjust people that are very old or very young with a high degree of safety with this instrument. Instead of using a manual thrust. So I'm going to bring Les in, and we're going to demonstrate this technique, and I'm just going to show it to you on a neck, which is one of the ways that we can use this. Is we'll feel a portion of the spine that's not working correctly and is out of its correct position, and here I'm using the double tip, and we'll position it right where we know that bone's out of place. So we can begin tapping, which begins to build motion into that joint, helping it to move better, be pain-free, and be healthy. And what's unique about this instrument is we apply the force. We can take the patient literally through a range of motion, adjusting this patient where the restrictions are. Now, Les has a restriction going backwards, so we can apply an adjusting force while he extends through the spine, helping him have a greater range of motion and greater health in those joints of his neck. So we can also go forward and also work the side-to-side motion. This is really beneficial in cases that have arthritis in their neck, that can't tolerate manual adjustment. So we would do this for 3 to 4 minutes as we worked the ranges of motion that we needed to work on. How a typical treatment is done in the office. Some of you have curiosities about what an adjustment really is, what we're trying to accomplish. So I wanted to show you what it looks like. Here we have Chris, and Chris a while back became a patient because he was in a motorcycle accident and really torqued his spine out of place. So we've been working with him. His spine's doing a lot better, but he still needs adjustments to keep things in place where it created weaknesses from the accident. Start off with adjusting his neck. I'll show a manual manipulation or manual chiropractic adjustment, as well as the use of the ArthroStem as we go. And the big thing when we're adjusting someone is we want to feel where the spine isn't working, where it feels stiff, and that would be where the nerves are having a problem. He has a problem in his upper neck on both sides. So we'll go ahead and give that a light adjustment. That's perfect. A little bit lower on this right side. Perfect. Excellent. Now, when we adjust the middle back, there's different types of adjustments that we can do, but with Chris, he needs this particular type because he has a problem where the bones have been jammed forward. There. I was just feeling where it was, and then I'll have a light contact here and a little pressure to help that move. Let's do the same thing just right below. Okay, great. Now, let's address the low back. Turn towards me on your side. Lower back is really important to have moving properly and in the correct position, because if it's out of place and one hip's higher than the other, your walking can cause pain in the back. You can develop hip problems, knee problems, all these things. Just generally feel where the problem is, right at L5 on Chris today. And perfect. We do a little adjustment there. Good. Yeah. Now let's go over on your stomach, face down. So sometimes after the manual manipulation, there's more work that's needed in the spine, but I can't continue to do manual manipulations. The body just won't have it. So that's where the arthrostem comes in. It does the same thing. It gets the bones in the right position, also gets the bones more flexible, but does it with a lighter force. So with Chris, I'm just going to go over the main areas that are having the problem, and it just does a very light tapping, which helps the bones move right into place and become healthier every time that we do it. Good, I can feel that as I push, the spine's becoming more flexible. That's the goal. Okay. So we monitor it before it feels very stiff. After we apply the arthrostem, the area becomes more flexible. That's the goal. That's how we know we've achieved what we wanted to do. Now, just a touch here. That gets the neck in a better position, also helps it to function better. And lastly, we go over the spine with a little vibration therapy called the master massager. This is the patient's favorite part, I think. But it really wakes up the nerves, helps the circulation in the spine. And the better the circulation and the better the nerves are working, the faster that you're going to heal as a patient. All right, Chris, you are all tuned up, my friend, and that's a successful adjustment here at Chiropractic of Bellevue. Hey guys, Dr. Owens here. I'm here with a patient, Chloe, and I just wanted to show you one of the things that we can do with your shoulders, especially for someone who has chronic shoulder problems, issues where uncomfortable cracking and popping occurs. One of the procedures we do in this clinic is a procedure called kinesiotaping. And the kinesiotape, when we put it on there, it actually lifts the skin up, allows fluid to flow through the subcutaneous space, allowing the joints to heal. It also brings up nervous system awareness of these joints, so the joints move freer and smoother. Every time the patient moves the joint, it's actually causing a healing action. With Chloe, we just put it on. We taped her scapular muscles here, where a lot of people have pain in between the shoulder blades. This can help support that. We did the trap muscle, as upper traps can get really tight and are involved in the whole shoulder girdle scapular complex. And then we did a basic deltoid taping, where we taped the outer edges of the deltoid here and the support strip up the middle. Pretty thorough shoulder taping job. I just wanted to show you it is within the scope of some of the things that we do. So, whether it's a simple problem or whether it's a really complex problem, we can help you out. All right, have a great day, and Dr. Owens, we'll love to see you soon.